Good afternoon. I'm Scott Kashman. I am really pleased to be filling in and participating in your Healthy Lifestyles class today for Mr. Nathan. And we've had a chance to do this over the past couple of years with me and Kristen Collins. And sorry that we couldn't be there in person today. I did want to spend a few minutes and fill in through a video where it may prompt some discussion that you all can have as a class. Right now, we're going through historical times that we'll be reading about, and our kids and their kids will be reading about for years to come with the coronavirus or COVID-19. And right now, my role is with Lee Health. Actually, Mr. Nathan is one of the key reasons that I joined Lee Health. And my role is Chief Officer for Hospital Operations, so I oversee our 4 acute care hospitals. When I started Lee Health about 9 years ago, almost 9 years ago, I was the administrator for Cape Coral Hospital. And so as we navigate through these times and still keep focused on healthy lifestyles, I wanted to share some thoughts on what I'm seeing as we're going through our incident command and really what we've been going through for the past month and what we expect to go through for the next couple of months as we're navigating through this, and really with a key focus, as you're all focused on in this class, on healthy lifestyles. So for me personally, I have a passion for healthy lifestyles. I have a background as a psychiatric counselor, which I did for 5 years. Also a background as a personal trainer, which I just did for fun to get more knowledge in the health and well-being space. The number one thing that I really believe that I need to focus on in my role as a healthcare executive is the health and well-being of our team. Because in turn, if we can set up an environment where they could take good care of themselves, then they take care of themselves, their colleagues, and ultimately it benefits our patients and their family members. And they get to be great role models. And in healthcare, there's really not a lot of great healthcare role models. Mr. Nathan is certainly one of them. Kristen Collins, who I've presented with in the past, is certainly one of them. But in healthcare, we unfortunately don't see enough people who are really those role models of what it means to be holistically have a good perspective and really live healthy lifestyles themselves. So as we're navigating through these crazy times right now with the coronavirus, and people are very, very scared. We right now have an incident command set up for the health system. And so every day I focus on 3 things. So when you talk about a healthy lifestyle, you have to look at the things that you can actually control, the things that you can most influence, because what's going on right now, we can predict, we can forecast. I'll talk about that in a moment, but you can't control it. You can only look at, the things that you can control for yourself. I mean, if someone had said to me 2 months ago, this is what's going on, no one would have ever believed it. No one would have ever believed that you'd have the whole nation pretty much shut down and the economy going from the best it's ever been from a financial standpoint to just having record losses from back in 2008, and just really, really unique times. Now, what's exciting about this is we get to learn from this. So what I focus on in the workplace is to make sure these 3 things, and I'll go back to these three. I focus on one is what can I do immediately? So for me, the immediate is focus on the safety and the well-being of our team and our patients. Focus on the safety and well-being of our staff and the patients. So what do we have to do immediately? The second thing is, what do we need to do more kind of on an intermediate basis? So the next 1 to 3 days, what do we need to focus on? And so those are some of the things that could be coming up the next few days, where we need these type of supplies, or we think we're going to need some staff to have more beds that are coming online. The third thing is really what's emerging. So about a month ago, we realized that as this continued to get bigger and bigger, we were going to need more beds that were focused on coronavirus patients. And so actually, Mr. Nathan is the one who several years ago had authorized the expansion at Gulf Coast Medical Center of 216 beds. Now those are supposed to go online in about 2 or 3 months from now, and we were going to use them for some specialty services, and ultimately we still will. But literally 3 weeks ago, I pulled the team together and said, this is starting to emerge, and we need to start to cohort patients who are either infected with the coronavirus or we're suspected that they might have them, but we want to try to cohort them on one unit. So it's really to help with your resource management. And so we pulled this team together for 3 weeks, 3 weeks ago, and said, this is what we need. And it's amazing. I mean, I've never seen a group move as fast as they did. And just a couple of days ago, they opened up the additional 216 beds that we're actually going to be using for patients that are coming in now, and just as importantly, patients that we're expecting in 2 to 3 weeks from now. So those three things focusing on are the immediate, the intermediate, and the emerging. What I do every day, because in the hospitals we have 1,329 licensed beds. Now with the additional ones that have come online, we have 1,545 licensed beds. So when you start to think about this in the season, we have run about 12 or 1,300 beds on average. Well, our volume has dropped actually to about 900, and 30% or a little more of 30% of our patients right now are either positive with coronavirus or they're suspected of having that. And so it can be very nerve-wracking for our staff, for our leadership, but certainly for the frontline team and the challenges that they're actually up against. And so you have to show up in a leadership position. You have to make sure that you're instilling confidence. You're also making sure you're giving correct information. You're communicating on a regular basis, and you're showing your own vulnerabilities, because everyone in healthcare, they all want to go run in, just like firefighters and police officers. Healthcare workers are real similar. They want to go run in, they want to go fix it. Even in a hurricane, people think they could last, and that could be like a 4-day to a 1-week process. Well, this is unique. We don't know how long this is going to last. And so when people talk about running a marathon, people use that cliche, and certainly Mr. Nathan, gets this analogy, and several of you probably get this. But very few people have actually run a marathon, and and I've been fortunate. I've run several in my life, and it's very strategic. You can't just sprint out in a marathon when you have 26 miles to go. In fact, those first 4 miles, which in this case would probably be like the first 4 days, you have to make sure you're setting the tone on what you want the rest of the race to be like, and that makes sure you're getting things settled in, you're getting your body and your breathing under control, you're making sure you know your surroundings, you're staying hydrated, you're making sure you have a clear plan in place. But I see a lot of people quickly running out and actually not always taking good care of themselves. And so one of the things that I do for me each morning, and I have each morning, while I do it regularly, I have been very intentional every morning before going into work. I at least get a run in. I exercise for at least 45 minutes to an hour every morning before I go in, so I can make sure that I'm centered, that I'm grounded. I've also made sure that I've added in meditation. Right now I'm following something that Deepak Chopra has, a 21-day meditation that I follow, and so I find that actually helps keep me grounded and calmer for the rest of the team. Those are things that I can control, so I make sure that I have a routine, taking care of myself, going in, smiling in the workplace, still being open to what the situation that we're up against, but that's what I know I can control. I make sure when I get back home, and even in the workplace, we want to make sure we're keeping the appropriate physical distancing. People use the term social distancing. You want to make sure it's actually that physical distance from one another, because people really need to stay connected. And the other thing I do for my own well-being is make sure I am staying connected, with people inside of work and outside of work, using video and the virtual, technology to be able to stay connected. And but every morning I take care of myself. The other thing I try to do is really in the workplace, making sure you find those times to laugh. While we're going through serious times, you also need to find those times to laugh. And then really making sure I'm eating well, because there's a lot that people are stressed and they just want to eat poorly all the time. Doesn't mean you can't have the time that you're eating poorly, but in order to kind of last through a marathon, you need to be able to laugh. You need to be able to be vulnerable. You need to be able to stay hydrated throughout. Because really that's what's going to get you through a time that you don't know how long this is going to last. And so when I just speak to, any stressful situation, you can only look at yourself as a leader and say, here's what I think I'm going to do differently to control myself. And so no matter what the situation is, in this case, something we've really never experienced to this large of extent around the world, in our lifetime, we get a chance to set the tone in terms of how we want to show up as leaders. And so that's what I'd encourage each of you to think about. How do you show up as a leader in terms of what's your part to play? And some of the learnings I've had as we've gone through this is your part to play isn't necessarily your exact role in the organization. You have that responsibility, but you also want to make sure that you're bringing your gifts and your talents. So as I've gone through this, and my learnings along the way has been, the immediate safety and well-being of our team. So it's who can help us with safety, and we're finding our infection preventionists are the ones who can actually help bring about safety measures that we all need to follow. It's our doctors stepping forward and coming together and saying, here's how we're going to work together to set the clinical protocols and roll them out consistently across the board. It's making sure I'm meeting with all of our hospital executives. We have 2 executives, a physician and a nurse executive responsible for each hospital, bringing them together every single day and focusing on key things that we're going to make sure we're doing the same across the board, because those are the things that we can control. Those are the things we can influence to put that right infrastructure and consistency in place, and safety measures in place across the board. We also talk about the fact that they actually have to cover each other so they can last a little bit longer themselves as a leadership group. And making sure that we communicate. We can control that communication on a regular basis. When I look at the intermediate and I look at some of those steps that are coming up that people need to take, it's looking at the supplies that are coming out. It's looking at what new changes would we see with CDC. So you need to get ahead of that and let people know we may make changes in the next few days. We may be shorter on supply, so let's make sure we're staying focused. You also want to forecast out and say, we may also find as we're getting tired, we're short with each other. So set the tone towards that shared vision of our goal is we have one focus, it's to keep everyone safe, and make sure by doing that we're focusing on everyone's well-being. And we're here to make sure we're saving lives as this goes on and on. But having that shared vision and that camaraderie with each other and that compassion with each other, and frankly just being civil, where you can say, we know we're going to get tired, we know we're going to lash out sometimes, so let's just give each other a little bit of grace period on that and a little bit of leeway when that happens. And setting that tone when it's not bad has been really helpful, because we've had those trying moments that were a little snappy and we're a little edgy with each other. And so you have to know that in advance. So as things become more immediate, it's 1 to 3 days out, you're not snapping everyone. You're just saying, hey, here's what we think we're going to need over the next couple of days. Let's make sure we're supporting each other. And then what's really cool is when you see the emergent needs. So right now, over this next coming week, by the time you see this, I'll be kind of midweek through this. We're looking at surge planning really for the next 6 to 8 weeks out in terms of how do we leverage the remaining of not only the 1,545 licensed beds, but we have over 200. We have 66 operating rooms that we can get access to and 182 pre and post-operative beds, because we could turn those into intensive care units if we need to. So getting access to over 200, that's just within the hospital framework. And then what we'll start looking at is alternative sites. We're going to look at ambulatory surgery centers. We'll look at Coconut Point, that we had set up a new site there. All of this, by the way, has been under Jim's leadership in terms of anything that we've built that I'm speaking to that was under Mr. Nathan's leadership and vision. But we have to look at all the other sites that we have, because ultimately what we want to do is how do we get healthier patients who are not infected with coronavirus, how do we actually get them to either one hospital, or how do we get them to other locations so we could start to cohort more patients who are infected into the fewer number of spaces possible to really kind of control that spread that could potentially go further outside the hospitals. Some learnings that I think we're going to find from this, the obvious one is going to be virtual. I think more people are going to be comfortable from a virtual standpoint. I think that we're going to find unique ways that we can collaborate with the government in terms of, loosen some things up where they can be loosened. Right now, I think, things are at a point that while you don't want bureaucracy, you also want to keep things safe. So if we may be, as you release regulatory, you do want to make sure that there's the balance of don't have too much red tape, but also have enough safety measures built in that things are safe before they roll out into the market. So you're not just having everyone out there just coming up with their their new cure for something. So you do want to make sure there's safety measures. But what I find is making sure you have those relationships with the governmental leaders, but we also sit in a position like where you can partner with some of those national firms. So we have a firm right now that's coming in who's got a testing that we're going to be able to use on site, probably by the time that you're reading this, and that's a big deal for us, because then you can be more precise in terms of how you're going to be taking care of patients as they come in a more timely manner. So I think what you're going to see is more virtual use. I think you're going to see more collaborations and partnerships where people are saying we could be even better around the nation, around the world, locally. We're seeing people reach out. We have Wicked Dolphin Distillery in Cape Coral that makes rum. Well, now they're making us hand sanitizer because we're running low on that. We have other companies who are actually able to help us put masks together, looking at how to put gowns together. And it's really watching those partnerships and the collaborations come together that if we come out of this and say, you know what, there's things that we learned in terms of how we collaborated, that we can roll things out faster and consistently across the health system, I think that'll happen. The use of virtual and leveraging, really the best talent around the nation and into our health systems, and frankly even other local businesses, will be helpful, because we don't just have to stay here locally. And yet at the same time, we don't lose sight of the people and the businesses that are local. We want to make sure we're supporting them to their greatest skill, that they can help bring towards some shared vision towards a healthier community. And what I'm also finding is you want to make sure that you're reaching out to people within your organization who actually have skills that may not be part of their job. So I have two people helping me right now. One who is an expert in regulatory and FDA compliance, who is actually helping, as we're working with some of these local companies, help navigate through the process to make sure they work through the regulatory process and the FDA process in a more timely manner because of their skill set and their background. I have another person who's an expert in the military from logistics, and so he's helping me put together all the logistical aspects of the surge planning over the next 6 to 8 weeks and beyond that, just because he has set up military tents and he can move very, very fast, and he'll think of things that none of us have thought about in the workplace. The other is we're going to really find out the importance of healthy lifestyles, because while we don't know what impact this virus has, what we do know is people who have underlying issues. Again, there's people coming in with no underlying issues who are still getting very sick. But people who have underlying issues, diabetes, cardiac issues, respiratory issues, we're finding they're struggling even more. I think what's going to come out of it, there's still a lot of kids who are, and I'm sorry if I'm saying this wrong, they're either using the juuling or vaping. Those are things that I think people don't even know what they're doing to their body, that when they get hit with the respiratory issue, they're going to be in big trouble, because they don't even know what they're doing to their body. And so when a virus like this hits, it can really wipe people out. And I think people, when they're done with this, I think people pay a lot more attention to their own well-being as it relates to washing their hands. How much, they want to be social with people, but how much they're just really a little bit more cautious on, keeping their own hands clean before they're touching their face, before they're touching other people, not doing so much smoking or juuling, not eating so much junk food. So when you do run into health issues, your body has more of a fighting chance to happen. But in the end, I really think that we're going to see some stronger leadership out of this. We're going to see stronger collaboration that's going to come out of this. We're going to see, people, I think, are going to be a little more civil with each other. I think people have a chance to realize what they're grateful for. Just a few days ago, I started kind of a gratitude journal. The other thing is I make sure as we're going through this, because there's a lot to remember and forget, I keep track of things that I find will be good lessons for us, so I could look back, later on when it's not so much a blur, and really learn from this. And so even for me, for my own health, I just remember, here's my part to play today. There's exciting things that we're going through in terms of how we're learning to lead together, how we're learning to collaborate together. But again, I go back to, I stay focused every day on what I could do immediately, what I have to do more intermediately, and what I need to do in terms of longer term. But for that, my part to play is how I take care of myself every morning. And then when I come home every night, my wife Jenny has a station set up that I have to kind of clean myself down, throw my stuff, my clothes in the washer and dryer, wash off my phone before I'm going in and hugging and kissing everyone else, because you also don't want to bring in what we're possibly getting into the house. as well. So there's things that we could do, but spending time with your loved one either on the computer or in person when you can, I think really helps people's own well-being. So I appreciate you letting me give this 20-some minute update for your class for you all to discuss in terms of how would you navigate through this as leaders? What are the things that you think you'd focus on if you were going through times that would be truly historical that we're going to learn from years to come? And one of the greatest things that I did forget to add is we used to see so much use in the emergency department, so much use in terms of our labs and imaging and all these things. But yet, if you take a look right now, we went from 2 weeks before this happened to having discussions on capacity, and there was too many patients in the hospital, and it was so dangerous because of so many people, to suddenly very few people in the hospital. I mean, our emergency departments are probably 30-40% down. Our surgeries are 50+% down. And some of that has been intentional because we've driven that. But take a look at you as a leader and what the influence you can have as a leader. Take a look at, now that people are staying at home, we've actually seen pollution go down around the country, around the world. We're actually seeing fewer people need our healthcare services where emergency departments were getting overused. So what's the part that you can play as an up-and-coming leader and professional? What's the role that you'll play to making sure that you'll promote healthier lifestyles that's not only for you, but for your community and for businesses for years to come? So thank you all for your time. Again, Scott Kashman signing out from Lee Health. Here I thought I was frozen, but I'm not. So this will be some of your bloopers. Be well and stay inspired, everybody.